My name is Javier Eckwer from the Institutional Learning and Change Initiative, and I can see the usefulness of all these evaluations for the purpose of auditing and reporting to the donors. But I'm really skeptical, and I would like your answer on that, or your point of view on how useful these these evaluations are for learning and for improving the implementation of a project. Let me put it in this way. By the time you get your results, the project is probably over and you have to start all over again. But the new project is is a new environment. Especially because once you did the intervention, you are changing the environment. Your simple evaluation is creating a new condition. Second, complexity theories will tell you that each project is unique. And then you have to have a specific approach for each project. So, also, I would like some comment on what you mean by rigorous, because rigorous seems to be like it's having some statistics and some regressions or comparison. That means rigorous, and I'm not sure that that qualifies in a case of a complex process where you have multiple interacting causes, where you have several changes in the interactions. So just by having a regression, that doesn't make us rigorous. It makes it restrictive and strict.
Right, okay. Rigorous is in the eye of the beholder. We'll come back to that. One just there by the microphone, please.
I'm HPS Sajeev, a pediatrician, a clinician, and I thought it was a fascinating presentation on orange sweet potatoes. And however, as a clinician and as a policy maker, I would be happy to walk the last mile in the evaluation. Yes, you have shown that the vitamin A intakes have increased. The question to me as a clinician and as a policy maker is, has it led to some health benefits for the population? Do you have some data on that? Did it reduce night blindness? Did it reduce the mortality and so on and so forth? That is a key question which will link in agriculture to health directly.
Thank you very much. I'm Tessa Richards. I work for the BMJ. I was Tessa Richards. I work for the BMJ, which is an international medical journal. I was interested in your concept of malnutrition being invisible and the need to assess it and measure it. And I was just wondering if good practice through World Vision, you've established a fairly sort of simple technique, simple indicators that you're monitoring over time, and if so, what are they?
Good. Well, that's three. Let's take those. I think, Daniel, I saw your hand in volunteering. We've got several questions. Do you want to start?
Thank you, and I'll try to be brief. I think it's a valid question about sort of how the learning is done through evaluations, and it'll vary by project to project. But in this case, the Orange plus Sweet Potato project, this was the first, that first sort of 2-year phase of the project is over, but there is an active program in trying to scale up that in Uganda, and we're actually using the results of these evaluations to learn about the most cost-effective ways to scale it up. So we actually have a lot to say about that from our research. We haven't just kind of punched the numbers on saying here's the size of the effect, but we've actually learned a lot about how social networks play a role in diffusion and how we could actually improve diffusion in a cost-effective way. So I think there's a lot of upside in terms of the potential to use this for learning. By rigorous, when I say rigorous, I mean that you have a well-measured counterfactual. So the counterfactual is the thing that would have happened to the treatment group had they not received the treatment. Randomized studies are generally considered to be the best way to measure that, the most convincing, but there's other ways to do it as well. But sometimes the randomized methods are actually very simple. There's no regression involved at all at the end. You just compare differences and means over time. So it has a lot to do with carrying out the evaluation carefully and measuring things well. But, so that's what I mean by rigorous. In terms of outcomes for the sweet potato study, we looked at serum retinol in Uganda. We did measure serum retinol in Uganda. We did not in Mozambique, in part because we were relying on Jan Lowe's previous study, the TSNI study in Mozambique, whose results are published in the Journal of Nutrition, that showed from a similar OFSP intervention a large effect on serum retinol. So we didn't repeat that in Mozambique. We did go after it in Uganda, but in a population that had much lower rates of vitamin A deficiency. You're only going to show an impact on those kids that were vitamin A deficient at baseline there. Infection rates turned out to be incredibly high. So we have not been able to demonstrate an effect on serum retinol there, but I think as a combination of kind of low status at baseline and really high infection rates. Thanks.
I'm happy to actually address the sort of rationale or the justification for these sorts of evaluations. I mean, I think what's really interesting, I come from the programming world, came late to academia actually, so I feel I can speak to this. I think there's a really interesting history with evaluation. So program planning has a much longer history. It goes back, thousands of years. Whereas evaluation history is probably only within the last 100 years that we've started to take very seriously evaluation. And I think that says something about human nature. We don't want to be critiqued. We don't want to really think, critically about our programs. But I think what I've observed is this is an extremely important undertaking, and that the organizations who recognize that benefit tremendously. And if you look at, I think the other thing that's interesting to do is to compare the for-profit organizations and the amount of money that's invested, for example, in R&D, and the percentage. This you mentioned earlier, the percentage that NGOs invest in evaluation. I'm not going to give numbers, but I can assure you it's far greater in the for-profit part of the market, the investment in R&D, and that's for bottom line, economic reasons. We're about human welfare, and so why are we not investing more to understand whether or not our models are working for that bottom line? So that would be
Okay. Thank you.
Yeah, the question about invisibility of malnutrition. That's the reality, because in most cases, in development context, you'll find most of the people actually doing development don't have a nutrition or health background. There are a lot of people out there in the field who have to actually make decisions that have a nutrition impact, but are not really informed on nutrition. And so one of the things, especially looking at the agriculture, I'm from the agriculture background, we've tried to, I can give examples in 1 or 2 countries where we've worked. Like in Ghana, working with the Ghana Health Services is trying to actually use growth monitoring at community level, whereby we use farmer field schools, whereby agriculture staff as well as the health staff work together, and the agriculture staff get exposed to that. And that kind of gives them a sense of really what is the reality in the community where they are working in. Otherwise, the issue of invisibility is still a big problem, because as far as they are concerned, things are like, they're always like this. But if you can bring people who can actually cross-fertilize them by giving them more training as well as exposure to some of these, and growth monitoring is one of the tools that we found has been effective in trying to do this.
I'm going to ask Marie to make a comment about methodology and what is rigor.
I actually have three comments on. First of all, on the issue of learning, I think it's very important to realize that learning does not happen once the report comes out. It starts from the very beginning, and the involvement of key stakeholders and program implementers, etc., should be from the very beginning. And in fact, in 3IE, we have very recently launched the requirement, basically from our grantees, our researchers, to develop what we call policy influence plans, where they delineate basically how they will work, how they will identify key stakeholders, what are their interests, how they will engage them, and then throughout the process with very clear interventions and clear interaction throughout the process. So that on one hand. On the other hand, learning doesn't have to, I mean, the programs don't actually have to take 3 to 4 years. There are several methodologies. We heard some of the methodologies. We talked about the randomized control trials, etc., where you go in with a baseline, ex ante, etc., and then you come up with a midterm survey and a final survey. Those take a long time, yes, but there are other methodologies such as quasi-experimental approaches where you create what they call comparison groups, which are basically groups that are identical on the important factors except for having had the intervention. And this can be done in shorter time spans. So it's not correct that necessarily what we call rigorous evaluations would take years. In terms of evaluation changes the intervention, yes, we do hope so, because otherwise we wouldn't be learning. So it is, the issue is then, of course, that one needs to evaluate a program at different phases throughout its implementation. And on the issue of the importance of, well, what is rigor? Well, in 3IE, what we call rigor is basically, first of all, the evaluation that is carried out needs to have a clear understanding of what is the counterfactual, what would have happened to this group or a similar group in all respects had it not had the intervention. That's what we have as a minimal criteria. However, what we like to see with all our evaluations is what we call mixed methods, where you try to understand, as I mentioned in my presentation, you try to get information from various sources, qualitative evaluation, process evaluations, along the causal chain to understand not only what was the exact impact, but why did it happen. Yeah, I think that's it. Thanks.
Thank you. I think we'll be a bit more generous in harvesting questions this time. I think those with the microphones, if we could start over in this patch which got neglected last time. Let's take about 5 or 6 speakers.
Hanna Mattinen from Action contre la faim, Action Against Hunger. It's a very specific question for Laura. In your assessment, did you take into account the impact on care practices, or are you planning to take that into account, more specifically the time spent caring of children and the impact on breastfeeding practices? And then more a comment, we talk a lot about stunting here, and I just wanted to put wasting also on table. Severe acute malnutrition, which is also a serious public health problem, and especially the severe form that causes an immediate risk of death. Thank you.
Done? Okay, thanks. Yeah, Robert Mazer from Iowa State University. Question about the Kickstart program. You mentioned, it seems to keep cutting, comparison between groups that have had the technology for 1 year versus 2 year. But I'm confident that in most communities, not the majority actually are purchasers of this technology. So I'm concerned about a couple of things that I hope you can clarify. One, those who can afford technologies usually are not the poorest of the poor. So you're usually getting a segment of the population already better off. And so in comparison, you'd want to know something about the other households in the community. Secondly, this is a technology that has the possibility to have a negative impact on non-participating households in terms of depleting water supplies. Probably people who are purchasing this technology will intensify or expand their production and might be hiring labor that would be coming from other households. That could have beneficial impacts in terms of wages that are earned. It could have negative impacts in terms of time away from working on their own fields, et cetera. We can probably spin a number of things off, but it seems to me that other population is also a really significant part to include in the evaluation. Thanks.
Hi, Allison Bear, USAID Mali. My question is about the orange flesh sweet potato. It seemed that the control groups in your study had no adoption of the variety that was being used in their intervention, showing sort of no natural diffusion taking place, and I'm wondering if the study can account for that in any way. Thank you.
Hi, Jodie Harris from IFPRI. I'm just wondering what the panel thinks might be the best way to actually disseminate the lessons learned from evaluations. I know academic institutions tend to pub peer-reviewed journals, and maybe Marie touched on it with the policy side, but I've seen a lot of NGO evaluations sit on a shelf, and I wondered what might be the best way to more systematically share key lessons learned so they can actually be used to improve programs.